Hi mom, I'm Hannah K. Tolentino from BSN3F and I'm going to assemble a chest tube drainage system. A chest tube drainage system is a sterile, disposable system that consists of a compartment system that has a one-way valve with one or multiple chambers. This is to remove air or fluid and prevent return of the air or fluid back into the patient.
These are the materials that I will be using. This is the chest tube drainage system that I have made. This is the first chamber, the collection chamber. Chest tube connects directly to the collection chamber, which collects drainage from the pleural cavity. It is calibrated to measure the drainage. Outer surface of the chamber has a write-on surface to document the date, time, and amount of fluid. The second chamber is the water seal chamber. It has a one-way valve that allows air to exit the pleural cavity during exhalation, but does not allow it to re-enter during inhalation due to the pressure in the chamber. It must be filled with sterile water and maintained at the 2 cm mark to ensure proper operation, and should be checked regularly. The water in the water seal chamber should rise with inhalation and fall with exhalation, which demonstrates that the chest tube is patent. Continuous bubbling may indicate an air leak, and newer systems have a measurement system for leaks. The higher the number, the greater the air leak. The water seal chamber can also monitor intrathoracic pressure. And the third chamber is the wet or dry suction control chamber. Not all patients require suction. If a patient is ordered suction, a wet suction system is typically controlled by the level of water in the suction control chamber and is typically set at 20 cm on the suction control chamber for adults. If there is less water, there is less suction. The amount of suction may vary depending on the patient and is controlled by the chest drainage system, not the suction source. Monitor the fluid level to ensure there is gentle bubbling in the chamber. A dry suction system uses a self-controlled regulator that adjusts the amount of suction and responds to air leak to deliver consistent suction for the patient. If suction is discontinued, the suction port on the chest drainage system must remain unobstructed and open to air to allow air to exit and minimize the development of a tension pneumothorax. When we water seal a patient, suction is removed and drainage is monitored to gravity along with signs of air reaccumulation. Repeat chest x-ray in few hours if there is symptoms of dyspnea and etc. Depending on the physician's preference and clinical circumstances, this is often a good test prior to removing the chest tube.